Thank you very much for inviting me to take part in this meeting. I'll begin by acknowledging that I'm joining from the unceded land of the Wurundjeri people of the Kulin Nation and pay my respects to their elders, past, present, and emerging. So I've been asked today to talk about consent waiver, and in particular, my experience of consent waiver in the English system. You can probably tell from the accent. I originally hail from the Northern Hemisphere, and we do things a bit differently over there. So I wanted to just share that experience and talk to you about how we have sought to develop our practice, certainly while I was chairing the committee, how we sought to develop our practice to try and ensure that consent waivers serve to promote public trust and confidence in appropriate uses of data rather than undermine it, which I think is a very real risk. So in England and Wales, consent waivers are dealt with through a single national committee. It's currently called the Confidentiality Advisory Group. It was previously known as the Ethics and Confidentiality Committee, and before that it was known as the Patient Information Advisory Group. So it's been around for a while. I joined it initially in 2007, which is about 5 years after it was established, and then I became vice chair, and eventually I chaired that committee in 2013 until 2018, which is when I came across to Australia. Now, CAG did seek to engage with public and patients during the time that I was involved, and while I was chair of CAG, we held a number of stakeholder engagement events. And I've shared this story before, so forgive me if you've heard it before, but for me it really does explain my approach towards consent waiver. I had finished presenting on CAG and its work. We often held these events to try and give people an understanding of what we did and how we did it and why we did it. And at the end of the presentation, at the end of the day, everyone was just kind of winding their way out of the room, and this one lady was hanging back. And she hung back, and she took me to one side as the room emptied, and she asked me if she might share with me something that had happened to her as a teenager. So at this time, this was quite a long time ago. Of course, I agreed. It was clearly something she wanted to do. And then she recounted something to me that was a very, very personal story. And I was clearly quite taken aback by what she shared. And she looked at me and she said, I've only ever told 2 people that. I told my GP, and now I've told you. And I wanted to tell you because I want you to understand what it means for me for somebody to have access to my GP record. I want you to understand what that would feel like to me if somebody accessed my record without asking me, without me knowing. That would be like somebody reading my diaries without permission. Most people don't have stuff in their health records that they're particularly sensitive about, but some people do. And when we grant researchers access to that information without their knowledge and without their consent, we are permitting what for them can be a profound intrusion. Now, it really hit home at the time, the significance of what we were doing for people's access to care, their trust, their relationship, the relationship between the patient and the healthcare professional, and the possibility that we might undermine that relationship and disrupt care if people no longer feel that they can confide in their health professionals in a way that they anticipate their confidentiality is going to be respected. So I'd always understood what the importance of what we were doing kind of academically, intellectually, and legally, because the setup in England and Wales is that on the advice of this committee, the common law duty of confidentiality is set aside, and researchers can do that legally that which would otherwise be unlawful. But it really hit home how important it was that we'd got it right for the people whose data was being accessed. And I was always committed to understanding how do we promote trust, but I kind of redoubled my efforts to try and ensure that every time we supported access, we did so under conditions that I genuinely felt I could sit opposite any one of the people whose data we were enabling access to, look them in the eye, and give them reasons for access that they themselves would recognize as appropriate. And they would actually want the data to be used in the ways in which we were describing. So I've become interested in notions of public interest, trustworthiness, and the relationship between privacy and public interest. And so let me say a little bit more about how I understand trust and trustworthiness in this context, and then how the committee that I was part of sought to ensure that we promoted trust in that exercise of power in relation to consent waiver. So when I was in the UK, I was also a member of another committee that was chaired by Baroness Honora O'Neill. I don't know how many of you are aware of Honora O'Neill's work. As well as being a formidable chair, she is a renowned philosopher, and Honora has written extensively on trust and trustworthiness. Very sharp mind, very clear in relation to what her understanding of what is the right thing to do, and our obligations when we're making decisions that affect others to be able to justify the positions we take. And Honora was always very, very keen that we recognised and respected the distinction between trust and trustworthiness. She used to say we weren't in the business of generating trust without it being warranted. She didn't say this, but it was kind of, that's what a con man does. It was about us to be trustworthy, and then we demonstrate our trustworthiness, and then on the basis of what we show, we invite other people to trust us. Because when people trust us, they expose themselves to a vulnerability, and we have to be able to make sure that we warrant them doing that, them placing that trust in us. So for Honora, trustworthiness was about ensuring that we could give people adequate, useful, and simple evidence that we are trustworthy. Now, there's a group in the UK that's done a lot of work in relation to access to patient data for research purposes, the Understanding Patient Data Group. And if you look at their website, and anyone who's interested in this space, I would recommend you look at their website. I think it's a very good source of much information. But they describe the conclusions that they have reached. Natalie Vanner led a lot of this work. And Natalie's got a video on the website explaining how they came to conclude that these are the things which matter in relation to trustworthiness, in relation to use of patient data. Motivation, competence, transparency, governance, accountability, and public participation. And they explain all of these in the video and on the website. So I'm not going to go through them all now. I do commend the website and the work to you. But I'll focus on motivation and competence, because motivation is one of the things that all studies of trust show that you need to demonstrate not only is somebody competent before you trust them, but you also have to believe that they're going to actually apply that competence in a way which is not going to take advantage of the vulnerability that you expose yourself to when you trust them. So you employ a plumber to go and fix your pipes. You want a plumber who's actually capable of doing a good job, but you also want one who's going to do a good job. They're actually, their integrity, their work ethic is one where they are keen to actually do right by you, and they're not just interested in doing right by themselves. So the work that Wellcome Trust has done in this space has demonstrated the importance of the answer to the question, why? Why do you want to do this? Why do you want to use my data? you need to be able to articulate a value proposition in a way that it resonates with the individuals before you can demonstrate a value proposition that's going to be compelling to them. That's about your motivation. And of course, your competence is then your ability to actually then deliver against that promise. So it's not just hype, but you can actually translate the research into real world benefits that you're claiming when you invite people to participate in research. The other things, transparency, governance, and accountability, are clearly all about also ensuring that the promises that are made in relation to why you're doing it and how good you are at doing it are kept. And public participation is about ensuring that we mature and evolve an understanding about what is an adequate competence and motivation in relation to these things, so that we can make sure that we explain why we're doing this in a way that actually resonates and is meaningful to the people whose data is being used. So if that's some of the things which we need to be able to demonstrate in that simple and effective way to be able to demonstrate trustworthiness, how did CAG try and approach this? How did we try and approach demonstrating trustworthiness in relation to consent waiver? Well, I should say just a word about the context into which the precursor to CAG, the Patient Information Advisory Group, was born. There was a national scandal in the UK at the turn of the century when it transpired that clinicians had been keeping parts of babies and fetuses for research without patient knowledge or consent, and tissue removed from children had been provided to commercial organisations for research, again without parental knowledge or consent. There was an uproar when people learned this was happening without the permission or even the knowledge of the parents. And the claim was that these samples were being retained because it was in the public interest to do so, because they enabled research to take place. Oftentimes, it turns out that the research wasn't actually taking place, but the researchers, the clinicians who were also researchers, were keeping it because they thought it might be useful. And indeed, many times, often it was, but they were just building up these repositories for research purposes. And there was too little benefit that could be demonstrated through the use. There was too little transparency with regards to the collection of the data. There was too little engagement with the patients and the public in relation to this use. The clinicians had an idea about what was in the public interest that did not ring true with the British public. In the face of the scandal that this prompted, there was a very real risk to any research being carried out in relation to tissue or data without consent. In fact, for a time, the GMC changed the advice given to doctors so that they didn't disclose data without explicit consent of the patient for any research use. Now, into that environment, the Patient Information Advisory Group was inserted as a watchdog to try and address the lack of public trust in research use of tissue and data at the time. So from its inception, it was keen to ensure that it operated in a way that it could earn public trust and protect public confidence that data was only being used in ways that individuals would have reason to expect and would accept to be appropriate. So how did it do that? Well, first and foremost, there was transparency. There's transparency in relation to membership, into the process by which members were appointed. All meetings were and are comprehensively minuted. The minutes of all meetings with the reasons for the decisions are available on the website, dating all the way back to the very first meeting. There is a public register which records the outcomes. Observers can attend. They weren't open in as much as members of the public could attend without notice, but they could attend if they'd asked and were given permission, just so we were in the right space with the right number of chairs, etc. Of course, we had lay membership. We operated with a particular conception of public interest that we'll say more about later. But one of the key things was the the stakeholder events, the kind of event that I mentioned at the opening of this presentation when I was taken aside by that lady who wanted to share that story with me, where we invited check and challenge in relation to the principles we were applying and our practice in their application. But also, as well as that direct public engagement, there was an indirect engagement because of the expectations we had of researchers. We expected researchers to engage themselves with the communities for whom they were claiming the research would benefit, so that communities themselves could speak to the need for the research to take place. So as I say, the work of CAG was public. The fact it was public, there are articles that have been written by researchers about the work of CAG and how it makes its decisions. This is one such article which looked at the thematic analysis on the feedback given by the confidentiality advisory group. As I said, the minutes are comprehensive. You can look at why things were supported and why they were knocked back. And they say 4 themes emerged. I'm only going to address the first one now, patient and public involvement, because it was a key one. And the patient and public involvement had to be more than tokenistic. It had to form an integral part of the research schedule and strategy. And they noted there were 2 phases in particular where public and patient involvement were particularly important. First, in the initial stages, within the methodological design of the study, there was an expectation that there was an evidence of feedback from the cohort whose data was going to be used, not the entire cohort. Sometimes these were entire nation studies, but a sample, so that, or a representative group that they'd engage with. So it wasn't just the researchers claim that this was going to be a good thing, but the research was addressing, as I say, a need that the community themselves recognized to be a need that needed to be met. But also there had to be efforts to be transparent by the researcher as to what was being done, with opportunities to opt out. So there were very, very few. In the time I was involved in the committee, I can remember 3 studies where we did not insist on practicable and proportionate notification and transparency with regard to the fact the study was taking place, with means for those who were particularly concerned with the use of their data to opt out of that study. So as I said, one of the things we tried to do was make sure we applied a particular conception of the public interest. I know I'm running short of time, so I'm going to be very quick here. It motivated me as an academic. I'm an academic as well as having had a number of public service roles over my career. And it motivated an academic interest in understanding how do we articulate this concept of public interest. And I have written on this. And I really boiled it down to three key considerations that I think anyone who seeks to rely upon the public interest needs to be able to meet, in this context at least. You have to be able to justify your decision in ways that give persons who are affected by the decision reason to expect the use. So you meet the no surprises rule that Dame Fiona Caldicott used to promote. No surprises, reason to expect it, and reason to accept it. So you have to be able to articulate the justification in terms of values and benefits which resonate. And you have to respect the individual choice. So you generally have to respect opt-out. And I think they're very closely related to trustworthiness, and I've written on that as well. The reference is there for those who are interested. But in summary, I think this leaves us in a position where if you want to promote public trust in relation to consent waiver, you have to demonstrate consistent competence in delivering safe and secure use of data, respect individual choice and control, and demonstrate value and benefit. Now, we don't rely exclusively upon consent or anonymization. We recognize they both have significant limitations, but we do work to promote transparency and enable opt-out and demonstrate how the use of data actually meets the needs of people whose data is being used. Thank you.
Excellent, Mark. Thanks for that. That was so interesting. I'll just bring up a couple of comments that people have made, and I guess we probably were all thinking along these lines. Yeah, a lot of them were with Aboriginal and Torres Strait Islander people. You know, what was the motivation? It was never about benefiting them particularly. So, as you know, then that was behind all of those, the new regulations and new guidelines for that. I guess there is also a question, I have to say this is kind of a pet one of mine, with, doing the approving waivers of consent. So we have the national statement with the various points, one of which is there is no known or likely reason for thinking that participants would not have consented if they had been asked. It's like, how do you figure that one out? What's a proof? And someone's asked, are there any resources or articles on what the public thinks of a waiver of consent? I don't know if you're aware of any in Australia. I've kind of had a bit of a look in that, thinking that, it's a kind of an interesting bit of research to do.
There,
You
there,
aware of anything much?
there are studies. There are studies when people look at models of consent. Um, you find that views are, as you'd expect, mixed. Some people want to be asked every time, they don't agree
Yeah.
with the idea of waiver, but some people are much more accepting of the idea of an opt-out model. So you get a diversity of views when you ask people what they would prefer. If you ask people what they're willing to accept, you find that there's a greater consistency and you can get greater levels of agreement around acceptance when you've engaged in the deliberative kind of dialogue with people and move beyond their first preferences.
Yeah.
But in all cases, I think I've come to believe that you need to be able to offer this reasonable justification for any interference with privacy. But you can do that. It's just making sure that you do the work and you are able to offer the reasons that are going to be persuasive to the individuals whose data is being used. In the one hand, it's really simple. On the other hand, it does require engagement with those individuals and the communities from an early point.
Yeah, exactly.